everyone. Leslie, the Colorado Acupuncturist here. I'm here with Dr. Martha Lucas in Capitol Hill area, and we're going to be talking with her, getting to know her, see what she does in her practice, and see what she's all about. So this is Dr. Lucas. Hi, how are you?
Fine, thank you.
Good. So the reason for my visit today is just to kind of get to know who you are, what you do as a practice, what made you get into this type of work, how long you've been doing it. So what made you get into this type of work?
Well, I'm a research psychologist, and so I started out my career in medicine, in Western medicine. I did research in hospitals. My patients were men who had had cardiovascular bypass surgery. That's how long ago it was. Not enough women were having heart attacks at the time, which now unfortunately we've caught up. But despite the fact that they had a great surgery, right, it fixed their heart, I was curious about what else is happening in the healing world. Like, what else is going on in their body? Their engine was fixed, the surgeon did a great job, but now what? Because researchers are curious, right? I wanted to know what else was going on. So I learned Reiki, became a Reiki master, then I learned axi-tonal alignment, about the energetic bodies out here. Then I learned color puncture, which is acupuncture, but you use a light pen instead of needles.
Oh.
And the teachers gave us all these pictures with parts of the body with like an Li4 and a green dot, and an Li11 and a blue dot. Well, of course, I want to know, I'm a researcher, why is there a green dot here and a blue dot there? And remember, I knew nothing about these labels. I was not an acupuncturist, I was just a person. And they would say, because Dr. Mandel says. Well, I can't be with a patient and they say, why are you doing that? And I say, because Akila said, Dr. Mandel said.
Sure.
So I went to Chinese medicine school just to learn about the whole color thing. And I met my pulse diagnosis mentor there. My first semester in school, he made me fall in love with pulse diagnosis. And now for all these years, that's my specialty, is the diagnosis, figuring out what is going on according to the pulses.
Okay. So what is the color therapy or the diagnosis? So, because we didn't really learn anything like that when we were in school.
It's separate.
So is it a pen that actually can detect a certain amount of energy?
No, it's a treatment pen.
Okay.
It's not a diagnosis.
Okay.
It's like it kind of looks like a pen light. Mm-hmm. It literally looks like a pen light, but it comes with separate crystals.
Okay.
So like the highest frequency of a red crystal, the highest frequency of a yellow crystal.
Okay, so it's a treatment.
It's a treatment, right.
Okay.
You still have to do your diagnosis.
Oh yeah, put the diagnosis, and if there's a deficiency or excess somewhere, you dial the pen to where you want it to treat for that excess or deficiency. Okay, nice.
So it's called color puncture. I think they still teach it somewhere. I don't really do it much anymore because I love needling, but...
Yeah, I see those pens that they kind of shock you a little bit.
Yeah.
It's like a tack and it kind of shocks areas. Yes, I've seen those, but I never heard of the color theory. That's interesting. Nice. And so you're an acupuncturist as well.
Yes.
You did get that.
Yes.
And how long have you been an acupuncturist?
I've been practicing for over 20 years.
Oh, okay.
Over 20 years.
Did you go to school here?
I went to CSTCM.
Okay. Yeah, because they were like 1972 is when they'd opened.
Yeah.
Been around a while.
I've been around a while. My choices were SWAC in Boulder or 3 blocks away.
Right.
So I chose the 3 blocks away, and I'm glad I did because that's where I met Jim Ramholtz, my mentor.
Oh, good.
So I never would have met him if I had gone to SWAC.
Okay.
He made me, his teaching about pulse diagnosis made me the practitioner I am today.
Mm-hmm.
So.
Yeah, I think, some of us don't do a lot of that.
Mm-hmm.
And I think that, bringing that back is probably be a good training or a class. Now, you mentioned you had some classes that you teach.
Yes, I teach that. I teach Mazen cosmetic acupuncture. I've been teaching that again for, at least 15 years. It's a specialized form of cosmetic acupuncture with needling techniques that were made in the Neijing. And then I teach pulse diagnosis, and I even will mentor people. Like, people can come to Denver. I go to people's clinics. Like, I travel to other cities and do a class called What Would Dr. Martha Do? Which means they bring me their patients in their clinic. I work in their clinic, basically, for 3 or 4 days. And they bring me all their patients that they're having a hard time making progress with. or it's a complicated patient and they need a better feel for the diagnosis. And then I give them a treatment plan for that patient.
Okay.
I love that. If I could travel all over the world and do nothing but teach pulse diagnosis, that's what I would do.
Yeah. Well, maybe someday you will.
Yeah.
So as far as the cosmetic acupuncture is concerned, are you using the needles around the certain locations of the face, or are you using kind of a plum blossom microneedling pen?
Mayzen cosmetic acupuncture is needles on the face. First the diagnosis and then body points to balance this out. Then I have a face protocol, a neck protocol, and an abdominal protocol for like tightening that up. Or fertility, we use it for a lot of different things. I do microneedling, but that's a whole separate thing.
Okay.
So yeah, there's cosmetic acupuncture, there's facial injections, as you know, there's microneedling, and I also do facial gua sha.
Okay.
So all of those are separate treatments and separate classes.
Okay. And you also do injection therapy, you said?
I do.
Okay. All right. Other than, that sounds like a lot. You have a lot of specialties going on. Are you teaching any upcoming classes anytime soon? And do you offer CEUs for that?
Oh, yes.
Okay.
My website, lucasteachings.com, is all the classes have CEUs. And I am actually teaching cosmetic acupuncture this weekend, actually, January 28th and 29th. And then again on March 4th and 5th in Denver. I'm making plans to teach in Florida and a few other places, but for Denver right now, I have those 2 dates.
Okay. And so for other acupuncturists that are wanting to add that to their toolbox, what is the cost of something like that for 2 days?
The in-person class is $549, and if you're an AAC member, the Acupuncture Association of Colorado, you get a discount.
Okay. And how many CEUs with that?
For either 12 or 14.
Okay. That's pretty good. And as far as your practice here in Capitol Hill, what kind of people do you see, treat?
Okay. Just a note about the class too.
Uh-huh.
It's one of the only classes that's going to pay for itself with your very first cosmetic patient.
Yeah,
Because I charge my minimum, like it's on sale price for cosmetic acupuncture is $1,500.
Oh wow! And is
Yeah,
that
it's
a package?
10 treatment series.
Okay.
Yeah, it's
So
2 times a
$10.
week for 5 weeks. So $1,500. So your class is almost paid for 3 times over.
Yeah, for sure.
Yeah.
So that's the normal rate for cosmetic acupuncture.
That's
10
that's like my
sessions,
on sale.
$1,500.
You know, it's $2,000, but if you pay in cash, it goes down a little bit, and then sometimes I have it set up
Sure.
for $1,500. So
And you do that twice a week.
twice a week for 5 weeks, because your dermis needs that reminder, right?
Mhm, sure.
So yeah, it's one of the biggest cash cows there is.
And it's about an hour long.
Yeah,
And you're using needles distally and
Yeah.
locally.
Yeah.
Okay.
Because aging, whether we're prematurely gray or anything, comes from inside, right?
Yeah.
It's coming from here and here, and so yeah, I treat. So as I said, the diagnosis is my specialty. So I'm known for kind of your complicated patients. So people who have been to other, I'm sorry to say, but other practitioners maybe, or been to the Western medicine, and they still don't know what to do, or they're they can't get a real diagnosis, or they've tried this and tried that. So I give them a diagnosis. I figure out what the cause is. Like sometimes it's old trauma. Sometimes it is your childhood trauma.
Yes.
That's all there is to it.
Mhm.
And that's one of my specialties, is changing that traumatic pattern. So I see people like that. Of course, I see fertility, some people with pain. I see a lot of women with period problems, clots and PMS and all that kind of stuff. So, the difference is everybody's different, right? I don't use a textbook, oh, the person has PMS, so now I'm going to do this.
Right.
I take their pulse and figure it out. So I even see children. I'm seeing actually a couple of young patients now, a 10-year-old who has anxiety, and she's ready to do needles now. We've done 2 acupressure meetings, and she said she's ready for the needles now. And she's on top of it. She presses those acupressure points in between treatments.
You got to start them
She's all
young.
over it,
Good.
you know?
I mean,
And the 13-year-old has been constipated for 10 years,
oh no.
taking Miralax. So we're going to get her body working again.
Well, good. Good for you.
Yeah.
Kids, it's good to start them young.
It is, and they heal so fast. That's
Right.
the beauty, right?
Exactly.
We're working with their original chi, right?
Yeah.
Well, they've got a little bit more than I have, you got to think.
Yeah.
Because I've used a bunch over the last years. But so I see kind of a whole range of people.
Good. Now, what do you charge for a basic treatment?
Well, I have a range. You know, I didn't used to do packages, but I started doing them a few years ago, mainly as an educational piece, because acupuncture is not a one-shot treatment.
No.
It's kind of like you go to the gym and want a six-pack. It's not going to happen one time. You have high blood pressure, they want you to take medicine. You're not only going to take it one day. So 135 is like, hey, you just want to try it. You're only coming once. That's the charge for that. And then it goes down to $315 for a pack of 3 and $594 for a pack of 6. So with each level you go down, the per session cost.
It's about around $100 or so.
Right. The lowest price would be $99.
$99, and that's about an hour treatment each time.
Yeah, 45 to 50 minutes.
Okay.
I see people on the hour and the half hour, so.
Okay.
Yeah.
And do you take insurance or HSA or anything like that?
I take HSAs. I don't take credit cards. I don't bill a lot of insurance. I'll give people a super bill for their insurance because I'm out of network. So insurance sends the check to the patient.
Mm-hmm.
So let them send it in, let them get the check. So that's how I prefer to do it.
Yeah, that's a smart way of doing it and less complicated.
It is way less complicated. Now, things like cosmetic acupuncture, those aren't covered by insurance anyway.
Sure, yeah.
If they want to use their HSA or whatever, that's fine. But yeah, HSAs are great.
Yeah, and that's kind of like a credit card, right? You just
But
use it
they
as
send you checks too.
they send you
HSAs, banks will send you checks as the client.
So they just
So
submit
they can write a check.
the receipt,
Right.
get
They
reimbursed.
can write a check to me, submit the super bill, and then the HSA says, oh yeah. Okay.
And reimburses them.
Right.
Okay.
Which is funny because I've never had to send a receipt to my HSA. I always just write a check to the practitioners, and my HSA has never ask a question. The money just comes out. So I don't understand why some people say their HSA needs a receipt.
Maybe they want the receipt.
Yeah.
Who knows?
But anyway, the super bill is the way to go.
Okay, well, good. This has been great. I love your location and your spot here. And if there's anything else that you want to add.
Well, this is my home office in Capitol Hill, but I also practice 2 days a week in Littleton at Littleton Internal Medicine Associates. So it's a Western medicine office, and I'm there 2 days a week.
And you're doing acupuncture?
Oh yeah.
Awesome. Okay,
Yeah.
and that's in Southwest Littleton?
It's by Littleton Hospital. So Littleton Adventist Hospital,
Mineral,
70,
Broadway,
Mineral,
Mineral.
yes, Mineral
Okay.
and Broadway. I'm in that medical complex.
Sure. Okay.
So yeah.
Great.
And people can email me at drmlucas@acupuncturewoman.com. That's my website, acupuncturewoman.com. If they want to make an appointment or have a question, they can email me.
Okay. Sounds good. Well, thank you so much for your time.
Well, I appreciate your doing this.
Yeah, of course.